Hello and welcome to my presentation on tuberculosis. Let's start with what is tuberculosis. It's an infection caused by the bacteria called Mycobacterium tuberculosis. It can affect multiple parts of the body such as the lungs, brain, kidneys, or the spine, and it can affect multiple parts of the body at the same time. So you could have the infection in both your lungs and the kidneys at the same time. That infection causes an inflammatory response from the body's immune system against the bacteria. That leads to the formation of granulomas, which are small clusters of immune cells that form when the body's immune system reacts to an infection, irritant, or a foreign body. Granulomas in the lungs can cause cavitation, which are holes in the lung tissue and can cause scarring. Tuberculosis has been around for thousands of years, but let's start in 1720, when an English physician named Benjamin Martin was the first to theorize that tuberculosis is actually caused by small organisms that you couldn't see with the naked eye, and that it could be passed from one person to another by being around them, breathing the same air as them, or sharing food and drinks. In 1854, tuberculosis is now thought to be curable thanks to Hermann Biermer, who had tuberculosis, went into the mountains, and came back cured. They attributed their accelerated healing process to the good nutrition and fresh air they had in the mountains. In 1882, Robert Koch discovered a staining technique that enabled him to see the bacteria, which accelerated our understanding of the disease. Sanatoriums became popular and became home to many tuberculosis patients. They were constructed to isolate the patients and to prevent the spread and outbreak of tuberculosis. It also provided care and treatment for patients, such as giving them fresh air, and some lesser effective treatments included rib removal and shock therapy. Thankfully for Mr. Smith, we have better understanding and treatments today because he is presenting to the doctor with a cough, chest pain, and fever. Other symptoms can include a cough that is persistent and lasts more than 3 weeks. It is producing phlegm, and he could have blood in his phlegm. Weight loss, fever or chills, night sweats, loss of appetite, and weakness or fatigue. Mr. Smith is most likely going to receive a chest x-ray and further testing such as a tuberculosis skin test. That tuberculosis skin test is where a healthcare professional will inject a solution subcutaneously under the skin, and he'll follow up with the doctor in a few days to see how the injection site reacted. He could also receive another test called a QuantiFERON TB Gold test. That is where a healthcare professional draws a blood sample, which is then sent to a laboratory for testing. That test measures how the immune system reacts to a small amount of TB proteins mixed with the blood. Treatment plans vary greatly depending on what kind of tuberculosis you have. You can have active or inactive and drug resistant. If you have inactive tuberculosis, you are carrying the disease, but you're asymptomatic, so there is little treatment, if any, needed. If you have active drug-resistant tuberculosis, treatments can last for months or years and require specialized medications. If you have active non-drug resistant tuberculosis, treatment usually lasts for 4 to 9 months. Treatments include antibiotics such as these listed below. Left untreated, your chance of surviving tuberculosis is roughly 50%. Tuberculosis causes lasting damage. Even after successful treatment and recovery of tuberculosis, there are lasting effects such as impaired lung function, chronic respiratory failure, sleep disorders, and pulmonary hypertension. And you'll be more likely to develop other lung diseases such as bronchitis, pneumonia, and chronic obstructive pulmonary disease. If you don't treat it, or if you don't follow the treatment plan correctly, tuberculosis can permanently damage the lungs, causing restricted lung volume and an increased risk of respiratory problems. This can lead to a persistent cough, phlegm, and shortness of breath. It will definitely cause lifelong issues. That is my tuberculosis presentation. Thank you so much.